little bit today, and I know many of you are going to be, or some of you at least, are going to be taking a class coming up and talking about group process and group therapy and group skills. So I just wanted to serve this as kind of an introduction to it and to kind of go over some of the fundamentals of group therapy and, again, some of the techniques used in group therapy. There are a lot of advantages in working with groups. Advantages not only for the counselor or the facilitator of the group, but advantages for the people who are participating in the group. Groups actually provide kind of an atmosphere that's kind of similar to the real world, meaning the fact that you're sitting with people who are kind of sharing a common experience. If you go into a drug and alcohol group, there is going to be a group of people who have shared a common experience based upon their experience using drugs, or maybe possibly having a relationship with someone who had been using drugs. But there is a commonality to it. There is this kind of sense of universality to it, whereas I kind of know where you're coming from. I have similar experiences to you. And that in itself creates a social group, a group of people that the people who are in the group with can identify with. Now that's a really powerful process to be in. When you're working one-to-one with an individual and doing individual counseling, that counselor that person may be working with may have knowledge of kind of what is going on and some of the dynamics that have created some of the things in that individual's life, but that counselor may not have any personal experience with it. Okay, so being in a group of people who can actually share something that they can definitely relate to can be a very reinforcing factor in kind of developing some skills or learning some new skills and how to overcome it. So this social atmosphere becomes very, very powerful. Another advantage in the group is that the people in the group have the opportunity to test out new behaviors. Now, we can do that in individual counseling. You know, we can actually do that in individual counseling. But to do that in a group of people who can provide that kind of immediate support and immediate encouragement makes it easier for an individual to practice these kind of behaviors. Now, sometimes in a group, just as an example, one of the therapeutic techniques that is used sometimes, and whether it be in individual counseling or in group therapy, is something which we call the empty chair technique. And the empty chair technique may be having just this empty chair, and it could be in the middle of a circle of a room where people are sitting, or in someone's office, and a person may sit in that chair and may role play and speak to someone who they may be having a lot of anger with, a lot of fears with, a lot of apprehension, anxiety, whatever the case may be. And the person, whether it be the individual therapist or the group facilitator, kind of allows that role play to take place. In a group setting, when we do this empty chair technique, not only are they encouraged by the facilitator, but they have the support of the group members. And they feel safe within that support of the group members. So again, even a technique that can be effective on a one-to-one counseling basis can even be fivefold more effective in a group setting because a person feels supported by the members of that group, knowing it's a safe place to do that. So again, in a group setting, it becomes a lot easier as people get to know each other and kind of feel that kind of support and gain trust with the people that they're with, that they can practice new behaviors in otherwise that they may be reluctant to or fearful of. So again, a group can kind of provide that kind of safety circle, so to speak, where people can actually practice that. Also, too, in the group, members can kind of practice new interpersonal skills. They learn with the people that they trust, the people that they feel that they can relate to. They learn new ways of how to kind of talk, have certain conversations, interact, and feel safe within that group. Now, again, even when I was working with a lot of younger kids, essentially, younger teens, that would come in the group and they would kind of slam their chair and they would just be really, really kind of defiant in the sense that they were not going to talk to anyone. And a lot of that was basically they had no interpersonal skills. They didn't know how to do it. So it was a lot easier for them to shut down than to take take a kind of take the risk in starting to get to know people on a different level. These kids, after the trust would develop within that group, became very, very friendly with the people within the group. They trusted them. They felt safe with them. They learned how to talk to them. They learned how to relax with people. And this happens in groups. You see people that come into groups that are kind of very kind of shy, maybe timid, maybe kind of just kind of afraid of kind of being in that setting. You can see that transformation take place after 3 or 4 weeks of working with a group, how their personalities change. And those skills that they learn within that group setting, they're able to take out of the group and use it in their real life. So again, these are kind of very powerful tools that people learn in a kind of in a group kind of setting. Another advantage of a group, it's cheaper than therapy, quite honestly. You can get one-on-one therapy, and if you don't have insurance coverage of some kind, it can get costly. But in group settings, especially open groups, many groups are usually done by donation. You kind of give what you can, or there may be one fee for the entire the entire length of the group. It may be a 10-week group, it may be a 12-week group, or some groups you can kind of pay as you kind of go along. So for many people, it becomes much more cost-effective to kind of work within a group setting than to go to an individual therapist or counselor and have to pay out of the pocket, maybe up to $70, up to $100, $120 a session. So again, it can be very cost effective. And group members or group help members see that they are not the only ones who have a particular problem or issue. Many of us kind of feel that sense of kind of hopelessness and that sense of kind of like depression, actually fall into a depression, when we feel as if there's nothing we can do and this is just kind of happening to us and we just don't know what to do. But to know that other people experience what we're experiencing and to hear what options and steps they've taken to get out of that situation, it becomes very therapeutic in itself. Just to know that I'm not the only one, and just to know that if this happened to a person who I've met in a group and they overcame it, then it gives me a sense of hope. The hope is that I too can overcome it, and maybe I can learn some skills to get out of that as well. This is very supportive in drug and alcohol counseling. To hear about if you're a newly recovering person, and to hear the stories of someone who has been in recovery for 2 or 3 years and has been successful, you hang on to that. You see that the possibility of overcoming your addiction is real because people have done that. So it becomes rather supportive in that. So again, this is really important in drug and alcohol, or even going to groups where people are suffering from depression and dealing with depression and hearing how other people get out of it. So again, just the fact that hearing other people describe what they've gone through and what they've done to overcome it gives that individual a sense of hope. And again, obviously, groups provide members with support. Groups, and we're going to talk a little bit more about this, but group settings as a group develops, and groups don't happen overnight, you have to kind of, it has to kind of work a while, and you have to kind of develop this sense of trust. But once groups develop this sense of trust, once people get to know each other in groups, they provide unconditional support for group members. And it becomes a very, very powerful, powerful process. So where a lot of people who start a group or are in some kind of therapy have never experienced the kind of support that they're looking for. Many, many times they find it within groups. Okay?